The Directorate of Health Research at the Ministry of Health on Tuesday updates the media on its findings on maternal mortality at a gathering at the Central Medical Store in Fatou. In his opening remarks, the Director of Health Research, Sini Sane, talks about the importance of the findings.
Today is also a very important day in the history of research in this country, that we were able to conduct a very important study that was meant to actually inform as well as build a baseline data for our ongoing surveillance. You'll all bear witness that tracking our health events is very important because it provides current and ongoing information to inform policies and also decision-making processes, to be able to be on top of issues rather than reacting to circumstances. This particular study was actually in collaboration with the UK Public Health, who actually provided the technical as well as the financial support. We also had some collaborating institutions like MRC, the Gambia, at London School of Hygiene and Tropical Medicine. This came as a result of the COVID pandemic. We all know when COVID actually came, we wanted to actually determine whether COVID was actually making more deaths than other health conditions. Because the country was registering deaths, but the data we had at hand then was so scanty to actually determine whether we are going to actually track the mortality related to COVID.
He adds that they receive data from various sources across the country.
We need to now go into taking data from very important data sources to inform us as to what the circumstances on the ground was. And these, our data sources were the health facilities, both public and private. We also collected data from communities. Communities in the sense that we also went to village health services where our community health nurses worked. They also keep record of very important health events, among which mortality was part of. Now, before even the start of this particular study, we had another study that was funded by WHO regional office, which actually looked into a lifespan of just 2 years, a 3-year span, 2018, 2019, and 2020. It was found prudent and important that it's good that we are able to at least have a minimum of five-year span that could also serve the purpose of creating a baseline.
He highlights the objective of their study findings.
We had some specific objectives that we set ourselves to be able to achieve at the end of the day. Among these objectives were to actually estimate all causes of death or mortality for both health facilities as well as communities. We also want to calculate excess mortality during COVID pandemic by comparing before and during. We also want to describe the differences in all causes of mortality between regions and also demographics, that is to say age groups as well as gender. We also want to describe the changes in mortality from January 2016 to June 2021. And the last but not the least, we wanted to determine the proportion of deaths that were observed by broad categorization of cause of deaths over time during COVID pandemic.
Sane said during their studies, they found out that overall, there have been consistency steadiness in all causes of mortality in the Gambia for more than 5 years.
We came to find out very interesting results. Just to give you a few of that actually had emanated from this study. Overall, there has been a consistency and steady trends in all cause of mortality in the Gambia over the past 5.5 years. And the average rate of mortality in the Gambia over the past 5.5 years was found to be 1.9 per 100,000 population. The mortality rate was much higher among the males in terms of gender compared to our female groups, and the age group 45 years and above, particularly those within the age bracket of 65 and above, and the age categories with the least rate of mortality was between the age bracket 5 to 24 years. Generally, rate of mortality in the Gambia has declined through the pandemic by 10.3%, 10.3 per 100,000 population.
During his presentation, Joseph W. Jatta, a senior health researcher at the Directorate of Health Research, tells the methodology they use in the studies.
The COVID-19 pandemic. So the methodology that was used, that was employed to conduct this study by way of study design, the study was an observational retrospective study designed to assess mortality, and it utilized routine data on deaths registrations in the Gambia from health services, both public and private, including large health facilities and village health service. The study population. This census mortality study has captured both health facilities and community deaths in the Gambia from January 2016 to June 2021. Sampling procedure. Mortality data was collected from all public and private facilities across the Gambia, including 39 private health facilities, 56 public health facilities, and 106 community health nurses.
The finding of the studies recommended more sensitization on COVID-19 and its consequences being intensified, and the health care services be decentralized to reduce the mortality burden in West Coast Health Region 1. Reporting for Kerr Fatou, I am Ramatullah Jao.